Okay, let's go live until my kids beat down the door. Anyway, I'm Ginille. I'm a cosmetic nurse practitioner. I've been injecting Botox fillers since 2013. I focus on natural looking aesthetics. I've got 3 medical spas. Two are in Los Angeles, and 1 is in Las Vegas. You can find us under JASI Skin Wellness, formerly Ginille Beauty Aesthetics. Please let me know if you have any questions. Jump in, say hi. We can do live consults on here. And this is me prior to having any aesthetic treatments. I'm 38 years old now. This is me when I was 28 years old, prior to having anything. I can talk to you about all the treatments I have done. I can talk to you about the treatments that we offer in our office. We see patients of all skin types, all skin tones, again, focusing on natural looking results, getting a natural aesthetic outcomes where you look like yourself, you look refreshed, no one will know you've done anything. That's always a goal. Hi, Margarita. Yes, I'm in the South Bay. I live in the South Bay, but I work in Torrance, Mar Vista, both of those areas in Los Angeles. And then we have an office in Las Vegas. You can find us under my name, which is Ginille Beauty Aesthetics, or JASI Skin and Wellness. We are currently switching out our website, switching out all of our branding right now. We do all the things in all the offices, everything from Botox filler, natural filler, so the one made completely from your own blood, skin treatments, including aerolase, biorepill chemical peel, skin pin microneedling, hydrofacial, everything we do, safe for all skin types and tones. And then we have a whole hair health program, as well as weight loss and wellness program in our office. I can talk to you about the most commonly asked questions I get, or if you have questions, feel free to jump in. Let me know your questions. We can also, patients will come on here, or people will come on here, and we'll do live consults. If you want, you can also set up a time to consult virtually with me or in person with me and my team. But yes, probably the most commonly asked thing people will say, like, talk about what's the natural filler. They want to know, what can you do for under eyes? What can you do for smile lines? So I hear these questions every day. Every time I'm on live, I will go over those. Lisa, I can't wait to see you. I hope you're doing so great. So when we talk about under eyes, people will say, I feel like I look sunken. I look tired. I've lost volume underneath my eyes. I have dark circles. Sorry. What can I do for that? So when we're thinking about sunkenness, hollowness, we're trying to restore volume. We can restore volume with traditional filler, hyaluronic acid based filler. Hyaluronic acid is a sugar molecule that we have in our bodies. It binds water. The fillers you might be hearing are things like Restylane, Juvederm line of fillers. Within those lines, there's different products. We choose different products depending on who we're treating, what the goals are, like how deep or sunken their under eyes are. So different products depending on the patient. You'll get an instant result. Well, you'll see the sunkenness lift up. You could bruise, you could swell. We want that to settle. And then we have you come back for a second session to follow up, touch up if we need, at 6 to 8 weeks. I tell patients under eye filler lasts, 1.5 to 2 years. However, most patients get longer than that out of it. If you don't want to do traditional hyaluronic acid filler, you can also do the natural filler. So PRF, Easy Gel, all natural filler alternative. This is made from your own blood entirely. We draw blood from your arm, spin it in the centrifuge, and then it separates out your platelet-rich fibrin and your platelet-rich plasma. That is your growth factors, your stem cells, like all the healthy components of the blood. With that, we heat it and we cool it, and we are able to make a gel out of it, and then we can inject that in your face. Common areas are under eyes, smile lines, but you can do it anywhere in your face. I myself have done it under eyes, smile lines, cheeks, temples, chin, corners of my mouth. Like, I've done my whole face with the natural filler. I'm breastfeeding a 2-year-old baby that's going to be knocking on this door soon. And so I can't do traditional filler, but the natural filler, since it's made for me, I can do, and it gets better over time. So wherever we inject that, it makes new collagen. Wherever we place over time, it can take up to 6 months for new collagen. So that's something to keep in mind when you are getting this treatment done. It's not as, quick and instant of a result as traditional filler, but anyone can do this. You're not going to have an allergic reaction to it. You're not going to have lumps, bumps. Like, it is very chill, and it continues to get better over time. So that's something to keep in mind. I think stress has aged me a lot, Jade. Definitely stress will do that to the face, and like just overall inflammation in the body that will cause aging on the face. So I tell patients, as much as you can try to do like lifestyle changes, the easy stuff that you can do without doing Botox, without doing fillers, like easy things: hydration, good sleep, eating a healthy diet, exercising, basic stuff that I know we all know. Sleeping on your back. Don't sleep on your face, because that's going to cause creasing and lines. Wear sunscreen. That is like easy. I'm like, if you don't, I should change this light up, but if you don't want to do anything, maybe that. If you don't want to do anything, at least wear some sunscreen and reapply it. Use a retinoid. That will also help turn skin cells over faster. It helps with fine lines, pores, skin texture, dark spots, acne, collagen stimulation. So I'm like, those are things you can do at home without ever having to see me. And honestly, like, the better you come in, the better shape you come in if you do decide to get treatments, like, the easier the better the healing, the quicker you're going to see the response. So we try to tell patients it's not just what we're doing in the office, but what are you doing at home to maintain your results and enhance your results. We really want to help people get, great lifestyle choices and then the right skincare to maintain the results. Let me see if there's questions. If you have questions, please. Someone said, Jade said, simple changes. I found it easier to use a stick SPF. Yes, I'm like, use one that you like and that you will reapply. And yes, all skin types, all skin tones. Yes, Black and brown women. A lot of people will tell me, oh, I'll do it if I go to the beach. Oh, I'll do it if I'm in the sun. I'm like, no. Like, we gotta reapply it. Like, if you're driving around LA or Vegas, where there's a lot of places, but if we're getting sun on the skin, it can totally age the skin. There is a photo, you can Google it. If you Google like truck driver skin, like aging, sun damage, you can see this truck driver. He's old. He's probably, I don't know, looked like 90 years old. One side of his face looked 150 and one side of his face looked 90. And the side that was 150 was from him driving for years and years and years and getting a bunch of sun exposure and sun damage on one side. And so it just goes to show, like, yes, the sun damages the skin. Yes, the sun ages the skin. Simple thing you can do is use sunscreen, avoid the sun. Other things, people be like, I don't want Botox. What can I do? I'm like, okay, if you don't want Botox, like, you can train yourself to not make like such hard faces. Don't frown so hard. Don't squint so hard. Don't raise eyebrow. Like, the more you make those faces, the lines will get etched in. So those are the ways, if you're like, I don't want to do these things, how can I, keep looking fresh, keep looking like my best self? Those are all things that don't cost money or cost very little. Now, if you want to talk about treatments in the office, we can talk through those. Magnesium helps with sleep. Yes, I've heard that a lot for people. Jade as well. And like I said, sleeping on your back is something where you won't get creasing lines. A lot of people come in like, oh my gosh, look at these lines on my face. I'm like, oh, I can tell where you sleep. Or, oh, one side of my face is like so much flatter than the other. I'm like, what side of the face you sleep on? They're like, this side. I'm like, oh yeah, I can tell. Or like, oh, they have so much more sun damage on this side. I'm like, well, that's your driving side. I can usually see just some of the lifestyle things. Okay. So that is basic. Now, if you're like, okay, I got the basics down, or what can I do to keep looking my freshest self? Or, I feel like, some people will say they feel like it's too late. I'm like, it's not too late. But we can talk through all the things. Let me see. So when Sandra Maria said, how do I feel about under eye filler? I love it. This is me before I ever did under eye filler. This was me when I was 28 years old. Oh, you hear my kids. I'm now 38. I have 3. I breastfeed for freaking ever. I breastfeed for like 2 to 2.5 years, and they sucked the fat out of me. This was after my first one, really sunken underneath my eyes. I have since done under eye filler. I haven't had any traditional filler for the past 3 years because I'm breastfeeding this other baby. He's 2. But I've been doing the natural filler. So under eye filler is great to lift sunkenness, hollowness, anyone where they feel I got dark circles because they're sunken, they're, shadows created. Under eye filler is excellent if you're the right candidate for it. So to be a candidate for under eye filler, you have to be someone that doesn't get really puffy under their eyes. You don't cry a lot. You don't retain a lot of water underneath the eyes. You don't swell. Anybody that has like water retention under their eyes, not good candidates for filler. Filler binds water. Traditional hyaluronic acid filler. So this is like we're going through a lot of these questions before I decide if you can do traditional filler. Now, if you're a candidate for it, yes, traditional filler will give you that instant result. It'll help lift the sunken area. You can bruise, you can swell. We say let that settle, a couple weeks, so you'll have a pretty good idea of the result. But 6 to 8 weeks, when it's all the way integrated with your skin, then we have you come back in and we retouch the area if we need. If there's like any little spot because you were bruised or swollen that first round, we want to go ahead and touch up, add more if needed. But you should be able to see a difference right then and there after your first treatment. And we have so many patient before and afters showing under eye filler. If you go to the top of my page, I have like a series that you can see a lot of patient before and afters. If you go to our other page, our clinic page, JASI Skin and Wellness, somebody today commented, I want to see like Black women that have under eye filler. And I posted a bunch of them. So we have pictures, all skin types, all skin tones, all different eyes. So you can kind of see what does this look like. Other people that are not great candidates for it, if you have like the big herniated fat pad, so eye bags that kind of show, I tell patients we can't take away the eye bag. However, if you don't get puffy, you don't swell, you don't cry, you don't retain water, we can camouflage the bag to an extent. Some people, I can get it all the way hidden and it looks like surgery. Other people, I'm like, oh, you can still see a little bit of it, but it's not as prominent. And then under eye filler lasts a long time. I say 1.5 to 2 years, but most patients get longer out of it, which is really nice, but also really important why you want to see somebody who treats this area a lot. Like if it's not done right, it looks bad, straight up. I feel like injectors, when I see when stuff just like looks overfilled, that looks bad. So that's why we break it up into 2 sessions. Do some, let it settle. We can add more. We don't want it to be overdone. Or I see injectors just choosing not the right candidate and they're coming to me to dissolve it. I'm like, dude, when you told me you have bad allergies and you cry all the time, like you should have never had filler in the first place. That's on the injector to call it out and not treat you. Or I think the overfilled is the biggest one. Or the other thing I see is they only treat right here, but they miss all the lateral part. And so this is lifted and then the outside is sunken. That looks bad because then this will catch a shadow. So when we do it, we really want to think about the entire like lower part of this orbital rim. We're also thinking about the surrounding areas, the cheeks and or the temples. If your eyes are lifted and your cheeks are saggy, it's going to look weird. If your eyes are lifted and your cheeks are full, but these temples are sunken, it's going to look weird. So when we do things, we really want to look at your full face and see if we treat one area, how does this impact another part of the face? How can we make it look like you haven't done anything, but you just look fresh and you keep showing up looking fresh? That's the goal. We consider the full face. We talk through how the face is aging underneath the skin, like what we just can't see on the surface. We're not just looking at line chasing, but like where are we losing bone? Where are fat pads separating? Where are things sinking? That's how we inject, so then it never looks weird. That's the biggest thing. Okay, let me go through here and see if there are questions I have missed. That was a lot about under eye. So that was traditional filler. The other one I talked about is the natural filler. So that's the one we draw from your arm, spin it in the centrifuge, separates out your growth factors, your stem cells, and then we heat and cool that and we make a gel out of it and inject it. You can put that under the eyes. That's made entirely from you. So if you're not a candidate for filler, you still have hollowness, maybe you say, oh, I got bad allergies, so we can't do regular filler. We can do the natural filler. Remember, this one gets better over time. Wherever we inject it, it'll make new collagen over time. Okay, let me see if there was any others. North Jersey, do I know anyone? Calamus, I can't off the top of my head. I don't know anybody. Biggest things I would say if you're trying to find a provider. First of all, I see patients and my team see patients every time I'm in clinic from like outside of LA and outside of Vegas. People are flying in from even outside the country. But if you can't, I would love to see you if you are here. You can schedule a consult or you can get on here and we can talk, right on live. But if you cannot come to us, just make sure when you're finding a provider, you're looking for somebody, read their reviews, look at their before and afters, do a consult. Also make sure they're like licensed to do this. So there's a lot of things where people are like, I went to this random person and in their garage. I'm like, don't do that. I don't know what was injected. I'm like, don't do that. It's your face, not worth the risk of trying to save $50 and end up looking crazy. I've heard crazy stories over the years. I've been doing this since 2013. I've had people tell me all kinds of crazy stuff, and they basically have cement injected in their face, stuff that is not FDA approved, stuff that can't be fixed. Yeah, and it's trash. Like, don't do that. So read reviews, do a consult, ask questions, make sure they're treating people that look like you. So I try to show patient photos all day of like, hey, this, you're going to find somebody that looks like your face. I'm like, oh, I can show you because I've done this. This is all I do is freaking faces. And my team, this is all we've been doing. And I've been doing this since 2013. But you don't want to go and be like, oh, they don't even treat anybody that looks like me, or I don't like the way their patients look, or I don't like the way the injector looks. If they look crazy, they think that looks beautiful, and they're going to think that's going to look beautiful on you. So be mindful of that when you're trying to choose a provider. Okay. Are these procedures that have to be done yearly? Oh, Gina, when am I going to be in Vegas? I'm going to be in Vegas on the 14th of November, so in a couple weeks. So let me know if you want to be there. I go to Vegas like once or twice a month. The team is there seeing patients all the time. I just kind of come in, do full facial balancing for some patients that I'm there, and say hey to the team, work with them on anything they want to work on. But yeah, are these procedures that have to be done yearly? Lois, it depends on what you're doing. Some things require like filler. I said between 1 to 2 years, depending on the area, depending like of the face. If it's skin treatments, we're doing that more often. If it's your Botox, your wrinkle relaxers, like here, around here, your masseters, your, TMJ symptoms, that one might be, on a quarterly basis. So it depends on the treatment, depends on your goals. Yeah. Some people and you don't have to do it. Some people are like, what if I don't want to do it? I'm like, you don't have to. You don't have to do any of it. But to maintain the results, you're going to have to do maintenance just like we do anything. Our hair, our nails, our lashes, our car, all the things. Clean the house, just takes maintenance. Is the natural filler comparable to synthetic filler? So I think they're both great, and sometimes I use both of them on people. The natural filler, remember, it's going to get better over time. It's not going to give the instantaneous lift that we can get with traditional filler. Your traditional filler, I have different ones that I can pick and choose depending on who I'm treating, different ones that are FDA approved. For somebody who wants more of an angular, jawline, I can pick a really sturdy filler. If they have thicker skin, I can pick a really thick one. Whereas with the natural filler, I might not be able to get that same angularity or that same lift. So it depends on what we're trying to achieve. If you want something really contoured, really chiseled, natural filler is not going to give that, but it does help, I think, really good for softening hollowness, sunkenness, softening lines. But to super contour, no. I've done my temples with it. I probably would redo. I would do my eyes here. I've done my chin. I've done all these spots with filler. Remember, I haven't had filler in a few years. I've also done right here. It works. I've just been doing the natural one, and I don't feel like there's any spots that I'm like, oh, I need to go get regular filler right now. But it does get better over time. So when I first did it, I was like, I don't see a change. This didn't do anything. About 6 months in, I was like, oh, I don't look so haggard. So it just improves. Let me see if there's other. Hey, Z girl, I hope you're doing well. And then let me just make sure I'm not missing any questions. I have dark circles, but not hollow. Sorry, Cal. Do you think natural route is the best way? So if it's only pigment on your skin, if you're like, I'm not sunken at all, it's just the color of the skin, I don't know anything to change the color of the skin. PRF, the natural might do a little bit for improving the skin, but it's not going to change the color. If it's just I was born this way, it's not sunken. No matter what, it didn't get worse over. It's just been like this. It's all dark. I haven't seen anything to completely change the color of just natural darkness underneath the eyes. So for some patients, it's just the skin is darker. Other patients, it's you can kind of see the blood vessels through their skin. So I've tried with patients, some people will try a bleaching cream, a laser here or there, but I'm like, it's not going to really change darkness. If it did, I would do it, because that's if I wear something, I will put concealer because it's darker underneath my eyes. It's the one piece of makeup I will put on if I'm going to do something. What is natural route first time coming across your page? So, hey, note to self. So that is filler made from your own blood, your platelet-rich fibrin or platelet-rich plasma. When we draw your blood and spin it, separate it, stem cells, growth factors, we make a gel out of it. We can inject that anywhere in your face to make new collagen over time. Traditional filler, hyaluronic acid, sorry, my kids, calcium calcium-based fillers. Those are, not everybody's a candidate for it, but the traditional fillers will give you more of an instant result, whereas your natural filler continues to improve over time. Is Botox better for contouring than Restylane? Hey D, it depends on what you're trying to do. Botox, I wouldn't super say for contouring. Maybe if you're trying to like slim the lower face and you have a bulky masseter jaw muscle, it can slim and that can give you a little bit of a contoured look. But contouring, tell me what areas you're thinking about. If you're trying to contour cheeks, jawline, chin, that's going to be filler. And it might not be Restylane. There's different products. Restylane is great, but it really depends on the patient, how thick their skin is, how deep their bone is, what they're trying to achieve. That determines which product we'll use. And these products are not created equally. They're all a little bit different. If it is too loud, tell me. My kids are like playing in the bathroom and hanging out with daddy. Have I gotten anything for jowls? Yes. I have done a few things for jowls. So I've done filler into this area right in front of the jowls. So jowls, you guys, people sometimes are like, what is that? Jowls are when our fat pads are separating, they keep sinking as we get older, and then this part along the jawline kind of hangs and it'll look like a little saggy. It happens as we get older a lot of times, but we call this area the pre-jowl sulcus. So like the area right in front of the jowls, I've done filler, and the natural filler here. I've also done filler into my chin because I didn't want to just widen my face and then have like a set back chin. So I've done this area. I've also done Kybella. Kybella is a permanent fat dissolver underneath into this like jowl area to get rid of fat. And I've also done Botox, just not in a little bit, for these neck bands. And sometimes when you Botox into the neck, it can help tighten along the jawline and make the jawline look more defined. Let's see if my kids are going to break into this room. Somehow the baby always knows how to like unlock the door. He's 2. My face is super round naturally my whole life. I want a sharp, chiseled, contoured jaw and cheek. Let me see if I can see your picture, D. Oh, you're so pretty. Okay, I can't like see a big one, but I saw like your little photo there. Okay, so if your face is really full, just know there are limitations with what we can do like non-surgically. Sometimes when somebody has like a round and full face, what I will do is put a little filler in the lateral part of their cheek. So then their cheek, instead of having more of the fullness here, it looks more pulled back and like up, and the highlight looks pulled up. Sometimes we will do filler into the chin to elongate their jawline and make a highlight at the lower face. So then the light hits off their face up and then here. And so that can make it look a little bit more heart shaped and not just round and full. Usually I set up a bunch of photos and I click through and I can show you patient before and afters, or you can go through on the page. I just try to jump on here really quick because I knew these babies are going to come busting down this door in a few minutes. But most of the time I will set up pictures and I can kind of click through and say, hey, look how this patient looks more contoured, more defined here. Hey, and I can show different faces. But also if you go through my page, I have them there. Or if you message me, I can send you them. Hey, Carla, she said you're live. I started following you a few days ago. I love your work. Thank you so much. Please let me know if you have any questions, anything on your mind. I'd like to go live to go through questions, your goals, give you tips on what to expect, how to prep for treatments. Patients will also come on here. I think in this little box here, they'll invite, and then we can talk like face to face, and we'll do virtual consults like this, or you can set up a virtual consult one-on-one, or in-person consults with me and my team. So I'm Ginille. I've been a cosmetic nurse practitioner since 2013. I went to Stanford. I went to Duke. I'm very thorough. I'm a little bit extra. Like I want everything to be excellent. I'm dealing with faces all day. So I'm like, this is high risk area. Like your face is how everyone sees you and how you see yourself. So I take this super serious. You can read reviews from patients that I have treated under Ginille Beauty Aesthetics. You can look at patient before and after photos, look at patients. They make their own videos about their experience. We go for excellence, period. Like that's just is what it is. We focus on natural looking results. We want it to look like you. We want it to look fresh, never overdone. We focus on skin health, hair health. We don't want you just looking like, oh, look, I got contoured and snatched, but your skin doesn't look good because that looks bad. And we treat all skin types, all skin tones, and not a lot of people do that in aesthetics. So we treat everybody. They're going to look natural. If you see the people on our team, they're beautiful, they're natural. If you see our patients, we try to show pictures all over so you can see people. I'm like, you will find somebody that looks like you in our office. I have like really worked hard to, be able to showcase different patients. And it is shout out to the patients for letting us share their before and afters. Because if it weren't for them, you wouldn't even know these people have done anything because they look fresh and it doesn't look done. It just looks natural, and that's the goal. So we can talk through anything, anytime. If you have questions, you need you here on the East Coast. I will say every single time every day somebody tells me in New York and Texas. Those are the two that I hear a lot. Best procedures for under the eyes, not so much of wrinkles, but tired look. So note to self, you can do the natural filler that we were talking about to give new collagen and help lift like sunkenness. You can do the traditional filler if it's sunkenness, hollowness. You said it's not wrinkles. If it was wrinkles, that's more of a Botox. If it's like skin textures looking crepey, you can do your microneedling, and then using your retinoid is also going to really help. How long does it take to see results from Botox? When you do your Botox, most commonly people are going to do like forehead, around here, these little lines around here. You can do your neck, your chin. Different parts of the face you can do with Botox. So it's going to relax the muscles from being so active and making the lines on the face. Takes a few days to start kicking in, 2 weeks for the full effect. So that's something to keep in mind when you're planning these things. So sometimes I'll have people like, my wedding is tomorrow, I want to do Botox. I'm like, no. Or filler. I'm like, no, we don't have time. Like, we want to plan these things ahead. Right now, this is the time of the year. It's always busy because people are trying to just like look their freshest self. They're going to see friends. They're going to see family. They're doing all the things because it's the holidays. So I'm like, come before you have to show up, because like, I'm always like, are you about to go see your family? Are they going to say something if you're bruised? Like, do we have enough time when we're planning these things? Or you're about to go on a long flight, and you're getting ready for your wedding or your family reunion. Like, okay, and we just did your filler, you might swell. So we want to just prepare. This is why I'll go live and I'll answer questions. This is why we do consults, so we can just make sure you're prepped and like make sure the timing is set up, the right way. Okay. Let me see. What do I recommend for your first time Botox start? Oops, sorry. I would say, what are your concerns? Depends on your age. If you're like in your 20s, 30s, most likely, like a lot of people do their frown, their forehead lines, around the eyes. Those are very common areas. If you've got TMJ symptoms like clenching, headaches, teeth grinding, jaw pain, that's when we're looking at these. If you're trying to like relax, from pain. If you have pain, I'm always like, handle that first. Once we start getting like mid 30s plus, 40s, 50s, like definitely be doing the lower face. So Botox into like the neck bands to tighten along the jawline, Botox into the corners of the mouth so you're not making sad face and turning down, so you don't have chin dimpling. Those are the things. But if you're brand new and you're just trying to like dip your toes in, you're totally going to see a difference from like this, not make a frown and lift the lines and the upper thing. Carla, for sagging neck with some wrinkles, what would you recommend? Sunscreen at first. That's going to be important. Your retinoid, bring all your skincare, guys, all the way down. So like sometimes people are like really good and they just do here, but they don't do their neck and chest, or their skin treatments and they're only doing here, but then their neck and chest like is giving away their age because they've got the lines, the wrinkles, the dark spots. So that's one thing you can do at home. Your sunscreen, your retinoid. Sagging neck, depends on how much sagging. If it's like super, super saggy, okay, surgical. If you still got some like snap back to your skin, you can do your Botox into your neck bands to help tighten. And if it is, you can also do dilute radius. And have really good pictures of this too. On my page, or if you message me, Carla, I'll send them to you. So dilute radius for like skin texture, for wanting a like little bit of tightening, for crepiness in the skin. Dilute radius is a nice one. Radius is a calcium-based filler. It mimics bone. It's the thickest filler we have in the United States. However, when I say dilute, what we're doing is we're thinning it out. We're mixing it with saline, which is like salt water. We're thinning it out so it's not so thick, and we're getting those collagen stimulating properties. You can put it all over your neck, and people will just feel like it just feels tighter. Like, I just feel like I have some support here. You can see visibly like the texture is improved. And then skin pin microneedling, skin treatments, or your chemical peel, those are good for skin texture as well. Okay, let me make sure I'm not missing these. Do I do a mentorship program to show other licensed individuals how to operate a med spa? Prophetess, I used to do it. It just takes a lot of time. And like, if I do something, guys, I go 5,000,000%. I'm like just crazy. Again, I went to Stanford. I went to Duke. Like, my husband went to Stanford. Like, we both he's an oral surgeon. Like, we just want to be the best. And I did the mentorship and it was awesome. But like, it takes a lot of time. And then right now I'm like running the offices. I'm doing this. Like, my first and foremost thing is always like patient facing. And so right now I cannot. And then we have a whole bunch of providers in our team. So I'm always like working with our providers just to make sure they feel like the top of their game. But in this moment, I'm not God willing, I will do it again in the future because I really loved it. I have helped people start up their own medical spas. I've helped people a bunch of things get started in aesthetics, which is sometimes really hard to get started. And it's like cool to see them thriving. But God willing, in the future. I'm 27, Star was saying the forehead line. So yeah, forehead Botox. What Botox brand do I recommend, Nikki? I'm trying to go back for questions I've missed, guys. In our office, we use Botox, Dysport, Xeomin. I like them all. I've used them all. If I had to pick my own personal preference, like I would pick Dysport. That's just me because I feel like it holds on the longest for me and it's the strongest. And I kind of like to be a little frozen, but they're all great. And I use them all. And we have FDA approved Botox, Dysport, Xeomin, Jeuveau, Daxify, Leti Bobo. So there's quite a few. I tell patients, I'm like, try them. See if you have a preference on one or the other. If you can tell a difference, a lot of people are like, I can't even tell the difference, like whatever. So yeah, I can make any of them last a long time if I do really strong, or I can make any of them be very light if I do barely anything. So I inject them the same. I reconstitute them the same. Yeah. Okay. Sorry. Oops. I need to go back to, sorry, I wasn't trying to do that. Okay. Hey, I follow you. I was just saying I'm scared with my hooded eyes. They are falling. King Lexi. Sorry, guys. I'm going back to questions. I'm going to go up and down. If I miss your question, you can say it in there, but I am trying to scroll back. So if you have hooded eyes, and I don't know how old you are. You look young, girl. So hooded eyes, non-surgically, you can do Botox around here, around this muscle. So this muscle around the eye is a circle. It closes in like that. When we Botox here, instead of it closing in so tight, it'll give a little bit of a lift. Not going to be like that. It's not going to be, these exaggerated things. It's not like that, but it just kind of opens it up. People that feel like they naturally have heavy brows or lids really say like, oh man, it makes it feel more open. Another thing you can consider if you have temple hollowing. So if this part of the face, like the temples are kind of like sunk in, sometimes when we put filler or the natural filler or a collagen stimulator like Sculptra, this will kind of re-volumize and give some highlight. Not going to make you lifted like that, but give some support to the lateral part of the brow so things can look a little bit more lifted. And then surgically, I always tell people if you're open to surgery, before you do anything, like do all your consults, like don't rush anything. Just make informed decisions, because you might be like, babe, I just want to go get the surgery, just know all your stuff. And so that's something I will say. Carla, need an appointment? I can't wait to see you. Yes, please message me. If you guys want to see me or my team in the office, you can text the number at the top of my page. You can DM me. If I'm with patients and stuff, I don't always see the messages. But if you text the number, like I have team members that are on this, I also see all the messages that go through. And then they can help you with setting up a virtual call or in-person call, or in-person visit, or we can talk on here. I just want to try to connect with you a little bit beforehand, just to make sure, you know what to expect, how to prep for the treatments. Some people are like, nope, I've watched enough of your videos. I've been watching you for a long time. I already know it. We send you pre and post care. They're like, we still try to ask, you have anything special going on? We try to make sure the timing is okay for you. They're like, yep, I'm ready. They're just like, make my in-person visit. I'm going to do the things this day. I'm like, send me a picture and I can make some recommendations. And then sometimes they send me the picture and I say, okay, hey, X, Y, and Z, this is what we should be thinking about. It might cost around in this range, so we can help people with budgeting. And then we do the treatments. But I just want people, again, to be informed, not rushed with these. If they're coming in and they're like, oh, should I do it? I don't know. I'm thinking about it. I'm going to be like, nope, don't do it. Nope, go think about it. I don't want to, I'm not the one to be like, yeah, do it. That's not it. I don't ever want people to be regretting these things. So I just want them to understand. I will try to show patients that look like you, that have a similar concern to you, a similar goal and outcome. I'll try to show you, oh, you're talking about your chin? Here's somebody that really wanted snatch jawline. Okay. Oh, you want it just subtle? Here's somebody that wanted to keep some of her chin kind of recessed. Oh, you're talking about your nose? Here's somebody who wanted super straight. Here's somebody who wanted her nose tip turned up. Here's somebody that wanted to keep some of her bump. I got all the photos. I will show you all the different versions of different patients. Again, shout out to the patients for allowing us to use their before and afters, and just helping to share. And I tell patients, I'm like, if it weren't for you, people wouldn't know. And a lot of the patients will tell me, they're like, I only found you because I saw somebody's photo and it looked like me. And I'd never seen somebody that looked like me getting these treatments done. And so like they're like paying it forward too. Okay, recommendation for retinol. Yes, use our JASI Skin line. I love that one. If you've used a retinol for a long time, and you're like, oh, I use retinol every day and it has no issues on me, then let's get on to tretinoin, like a prescription one, and we help with prescriptions. Okay, I'm gonna go back through there. Carla said, message me, I can't wait to see you. Filler in the temples, nutty, heck yeah. Thoughts on it? Yes, if you are sunken, like people don't think about this area. And so sometimes they're like, what do you mean? Like, no, what are you talking about? My temples. I'm like, dude, I'm tired of walking around LA and just seeing people like do cheeks, and they think this is going to lift their face. And then their cheeks are like built out. And then this is sunken above and below. It looks bad. And like we lose bone here, guys. We lose fat here. This starts to like sink in and it looks, so then you don't have like full cheeks sunken above. It looks like you did filler, or it just kind of looks aged and people don't really know. I mean, look, you can see what I mean? Some of this right here, I'm like, I should probably put a little drop of there. Like just creates sort of like a shadow on the face. It kind of starts showing like the skeleton. Like think about the skeleton, got that big hole right there. That's the face starts to look a little skeletonized. It makes a big deal. It helps to extend, like when you have filler through here, it helps to extend the highlight of the cheeks all the way up. So then your cheeks look just lifted and pulled back. It helps to frame the lateral part of the brow. So the brow looks supported, not like sunken right here. It's just nice. It's one of my favorite things I've done to my face. It's just like this underrated area people don't think about. And I'm like, it makes a big deal. When I have done it, dude, I need to do it again. But when I've done it, when I go to my kid's school, the oldest he's in a K through 12 school. They're like, the kids were like, well, they saw me in the costume. They were like, not this year. This is another year. Because I could probably use a little. But they're like, what grade are you in? Like the kids, like the older kids, they were like, who are you? The nurse yelled at me. She thought I was a student. I was like, dude, I'm here to pick up my kid. You called. And she was like, I apologize. It was all after I did temple filler. And the mailman came and he asked me, he was like, can your mom come sign for this package? I was like, my mom, I am 30. I mean, maybe I was like 37, 36. Sir, I'm old. Like, no, my mom can't come here. So temple filler. And I was like, that's what it is. The temple filler. So it makes a big deal. Nobody ever thinks about it. Don't be doing just your cheeks and having sunken temples. It looks weird, guys. Not everybody needs temples. Not everybody needs anything. Nobody needs nothing. First of all, I always will say that. Like none of us need this, straight up, period. But if you're noticing these signs of aging, if you're seeing, you just don't want to like spot treat, basically. If you're doing these treatments, consider the full face. Don't spot treat, because if you're just doing this, above it will be sunken. It'll look a little off. But yeah, people are like, do I need this? I'm like, no, nobody needs it. Like now, do they feel more fresh after? Do they feel more confident after? Yeah, they got a little pep in their step. Can I see the glimmer in their eye in their after photos every time? Are they hyped? Yes. Do they maintain it? Yes. They are happy. They love it. They tell me it just makes them feel more confident. But no, none of us need it. I mean, I could have kept walking around like this. I didn't need it, but I felt better about it. I feel better not looking sunken and haggard. Okay, come to New York, please. D, I told you every single time. Mac, can I do your DAO? Yes. Okay, DAO, guys, for the corners of the mouth. This is a muscle here. Makes you turn down the corners of your mouth. If you Botox here, it prevents you from making sad face. Kind of gives a subtle lift to the corners. Rocky, hey girl, hey, if you're not doing it, I won't get it done anywhere else. I hope you're doing so well. Thank you so much. I appreciate you. And I love what I do, guys. It's ridiculous. Sometimes I'm like, dude, I'm working. So like, why am I doing this? I should just chill. But like, I love it. I can't get enough of it. I could just inject faces all day long. And it's not just the injecting. I freaking love the patients, man. It's like these like long life relationships I have with the patients. And I feel like we're in the room talking. The injecting part is like nothing for me. I can do that with my eyes closed. I already know what I'm about to do. Like, I'm like, I got this. But it's just like hearing the story behind the patient and why they're doing it and how it makes them feel after. And then I start to hear about just their life, what's going on. And I don't know, it's like it's so much deeper than like freaking Botox and lip filler that I know everybody thinks, oh, I'm just trying to sell Botox and lip filler. I'm like, no, it's not even that. Like, none of us need it. But I really do love the people that I get to see, and I am grateful, and I feel like, hey, this is what God blessed me to do. I'm going to do my very, very best. I I would be devastated if like I did something and people didn't feel beautiful. Like that's not it. So, but yeah, sorry, I get off thing. Teresa, I just got 10 filler 3 hours ago. Oh my goodness. Hold on, Teresa. Let me go back to this. I'm scrolling up. I got chin filler 3 hours ago. It is a golf ball right now and it is pointing. When will it go down? Okay, Teresa. So 3 hours ago, you're swollen. I would ice it. Now, I don't know. I hope they didn't just put it right here. You don't want it just right here. God willing, Teresa, they did it like to bridge it here, maybe the corners of the mouth as well. When I tell people when we do chin filler, I'm like, it's not just your chin that I'm injecting. I gotta blend it out, and it takes, you know, more than one, because if I just do filler here, it's gonna look pointy, it's gonna look like a ball. I gotta bridge it here to connect it to the jaw. I gotta soften here. It needs to look good from all the angles, not just one spot. But if you're just now seeing it, Teresa, and you just did it 3 hours ago, like the first few days, it's the worst. As the days keep going on, it gets less and less, not so exaggerated with your swelling. Ice, take arnica, avoid blood thinners, avoid alcohol, sleep on your back, don't press it. Try not to get super hot, super sweaty. Salty food, spicy food, that stuff will make it swell. You'll probably feel sore, like you got hit. You shouldn't have extreme pain. You shouldn't have vision issues. Skin color should look normal, not paler than normal. Paler than normal would mean like somehow blood is not getting to that area, and then you would get it dissolved. So those are all the like, hey, thank you, Jumbo, I hope you're doing so great. Those are all the things that I'd be concerned about, like from a safety thing. But if you're just saying like, oh, it looks a little extra, it's gonna look a little extra in the beginning. It'll chill. By week 2 to week 3, you'll have a pretty good idea of what the outcome will be, but it does take 6 to 8 weeks to completely settle. So I hope that helps, Teresa. I'm trying to look at your picture to see. Oh, you're so beautiful too. Yeah, so I hope they did here and like a little here, not just like right in this spot. And if you have more questions, please let me know. Okay, can you take a look and tell me what you think I need? I want to come in. Refresh. Can I come on panel? Yes, Zero, you can. Hey, how to feel like fixing your nose without surgery? I don't like my bridge and my side profile. Jumbo, you could do filler to camouflage a bump, lift the tip of the nose, to make the highlight from the front look straight. You can do Botox to like minimize nostril flaring, so then it can look a little slimmer. So those are some things. And I have really good before and afters of patient noses on our page. Hey Z, I hope you're doing so great. Let's connect and talk through here. I'm gonna make you big. And then if you have other questions, how much will microneedling run for? I'm sorry, I'm trying to see. How much is microneedling for treatments? So in our skin membership, I'm gonna turn your camera on, or I'm gonna ask you to turn. In our skin treatment membership, you can come in on a monthly basis. It's $3.99. You can pick from microneedling. You can pick from chemical peel, biorepill, aerolase laser, or hydrofacial. Hey, how are you?
Hi. Good.
You look so great. I like your hair.
Thank you. Well, I've lost some weight, so I have some sinking going on here. So, what do you think I need?
How much did you lose?
36 pounds.
Hey, are you going to lose more?
Maybe another 15.
Okay, so the face might change. That's like something we will probably reassess once you're like, hey, this is my stable weight where I'm gonna land. Where are you noticing it most, like the changes?
Like right here, like it's kind of look like kind of sad looking, like not happy. And I think like, around the neck part, I think like my jaw area. So this whole part.
Lower. Can I see from the side too? And the other side? Okay, so in through this right here, volume replacement. So I would do like either dilute radius or some filler or the natural filler. You can do any sort of thing to like soften here, but re-volumize, and then it'll help support the corners of the mouth so they don't look downturned. We don't want them upturned because that'll look weird. But I would do some sort of filler or a collagen stimulator into this spot. And maybe even through like the mid-face. Yeah.
Mhm.
It's fat. Like people lost 20, 30, 50, 100 pounds. Like I say, hey, fat pads in the face are going to start separating. So people get this line from their under eye that cuts through the cheek.
Right here, this line.
And then the smile line gets deeper, and then the corners of the mouth. So a lot of times when I'm injecting, I'm like, I'm looking where those fat pads are separating. So I'll put like some filler in through there. And then I'll put like maybe soften the smile lines and then the corners. This one I think makes a big deal, and people don't think about it until it looks like sad, sad, sad. But I'm like, softening that shadow can make things like look a little bit brighter and the corners of the lips not downwards. But I do, I tell people when it comes to the weight change, it's like we can start it now, but we'll probably end up, adding a little bit more later, or we can just start once you get to your goal. Some people.
And what do you think about this part, the neck part? Because, well, I had that surgery. I think I told you before, but I had surgery, so I have that permanent line there, which kind of makes me look like I have like, an overlay of skin, but it's really not. It's just from the surgery. But then now this part is starting to change as well.
Can I see the E?
E.
And then do it from the side so I can see if I can see your neck flexing. Okay, you can do a little Botox to like tighten in the neck. It's not going to be a neck lift, with aging and with weight loss and people have like excess skin underneath. I'm like, it's not going to pull you all the way back the way like surgery can. Botox can do a little bit to tighten those bands. So I would try that and then the next thing you can consider is some dilute radius. But I would try the Botox first and see if that gives you enough.
Okay. I'm going to make an appointment.
I'm so happy to see you. You're still at work?
No, I work from home now.
Oh, okay.
So I have my school and here at home.
Cool. Okay. Yeah. Let us know if you have any questions. Okay.
Thank you. I appreciate it.
Okay. Let me see if there's questions I missed, and I'm going to scroll through here. Okay. Oh, so skin treatments. Oh, I'm all blurred. I don't know how to fix it, guys, but I'm blurry now. I don't know what to do. Okay, skin treatments. Like I said, in our office, this looks weird. Okay, in our office, skin pin microneedling, Aerolase, laser, bio-repeel, chemical peel, and hydrofacial. Those are what we offer, safe for all skin types, all skin tones, no downtime with any of them except a little bit with your microneedling. So we can pick and choose on a monthly basis what treatment we're doing. It's $3.99 for the month. We will choose a different one depending on your skin concerns and your goals, and if you have downtime or if you want to be more aggressive. These treatments can also be stacked. So some people are doing, can I not be blurry? Does anyone know what to do? I don't know what I did here. So is there I don't know what to do. It looks just weird. Okay, you can do with PRP, yes. Some people will do them the same day. They might do like laser and microneedling and the chemical peel if they're like trying to work aggressively on skin texture or acne scars. You can do it the same day as your injectable. So some people are doing all that plus their Botox plus the natural filler. So this is why we talked through. It was like, hey, I want some downtime. I got a few days. I'm going to do this now. So we kind of talk through all the things to make sure it's a good timing. I don't know what to do on this blurry looking pixelated thing, but I will keep answering the questions. I love this live. D, I appreciate you. God bless you. Okay. What can you advise for under eye treatments and dark circles? Where are you located? Alicia, guys, does this look weird or am I just tripping? Okay. You can do filler or you can do the natural filler those are the main ones. So filler is going to give you instant result or the natural filler is made from your own blood. And then we're located I've got 3 offices. 2 are in Los Angeles. We've got Mar Vista, Torrance, and then 1 is in Las Vegas. $3.99 for the treatment for the month for the skin membership. If you want to stack on, if you're like, hey, I want to do the hydrofacial and the peel the same day. So I'm going to hydrate, deep cleanse the pores, and then I'm going to put the chemical peel on top of that to get some exfoliation. $250 to add on a second treatment. Or if you want to be like, I want to do my neck and chest as well, $250 to add on a third treatment. People that are in the membership also get the natural filler at a discounted rate. So our natural filler is usually $25.50. I forget. It's either $25 or $22.50. The numbers are all on there and I can text you these, but it's $25.50, I think, for 2 sessions. People in the membership get it for $9.50. So that's nice. They get all their things for a little bit less. Jowls caused by Bassiter tox. Super rare. You want to be a candidate for it. I've only seen where I felt oh, this didn't look good. Guys, should I just keep talking live with this blurred thing or should I hang off and come back? You tell me if this is weird. I want to book an appointment in LA. Can you message me your number? I'll have the team call or text you. Okay. Master your Botox. If you're just trying to do it to slim, and you keep slimming and this this keeps slimming, yes, you're going to notice more of this fullness here. So I tell people, like, make sure you're a good candidate for it. First, I really feel like use masseter Botox for TMJ symptoms, clenching, headaches, teeth grinding, jaw pain. Secondarily, I will do it for aesthetic outcomes if people are like, hey, I don't have any TMJ symptoms, but I really want to slim my face. I'm like, this is only going to work if your face is wide from this muscle being bulky. Like if your face is just naturally wide, you Botox here, it's not going to slim it if it's not caused from your muscles. But I ask my patients all the time, like, tell me, you think this causes jowls? They're like, no. They're like, I like it. If anything, they like the slimming of the face, but I'm not overdoing it. So that's the thing. Like I've seen it twice where I did not like the aesthetic outcome in all of my years. And these were two separate occasions. One was a medical student, one was a law student. These girls were coming in every 2 months. And I was like, y'all, like your muscle's not even flexing. But they were like, as soon as I feel it kind of move, I have pain. And I'm like stressed because of school and work. Do the dang Botox, girl. So we did the Botox and I was like, hey, I feel like this, your face is like pretty slim now because we have like really weakened this muscle. They're like, I don't care about the aesthetic outcome. I'm trying to feel good so that I can get through school. So those are only 2 times I thought it didn't look good because we were like almost like overdoing it, but for a therapeutic purpose because they were struggling. So that's just something to keep in mind there. I have terrible TMJ pain. Okay, for TMJ, it works so well. Like people say this is life-changing. They're like, I don't wake up with headaches. I don't have to miss work because I have headaches and pain and teeth. I don't have to break my teeth. How many people have I treated that have broken their teeth, have chewed through their mouth guards, that have all the dental problems? So I get a lot of referrals from dentists. Thank you for the loves. I get a lot of people, my doctor told me to come in. I'm grinding my teeth down. So like it really changes the life of the person. Like I just don't have pain. Like I can function. Thank you so much for these hearts, guys. I don't even know much about the hearts and the stars and stuff, but it's really cool. Tox cost per unit. Whoa, TOX. I don't know. So our Botox cost is 13 per unit with our other providers. It's 15 per unit with me. And then we do all the little rewards programs through Allie and Galderma. Guys, am I the only one tripping off of this? Probably, huh? It just looks weird. Maybe I don't know what to do there. I don't know. Okay. Do I have to commit to a number of months for the program, Joanna? For the skin membership, 6 months. And we do that because I'm like, guys, 1 month ain't gonna do it. So we price it to, like, you can buy a package. I think the package is like $2,000 for 4. Don't quote me exactly, but if you go to JanileBeauty.com and at the end of this week, it's going to be JASISkin.com. You can see our pricing, or if you text me, or message me, we can send you all the pricing. We do it to like really encourage people to get in there for 6 months. I'm like, let me improve your skin. I cannot do this in 1 month. It's just not it. Especially if you're black or brown. I'm like, y'all, I can't like burn your skin off and give you new skin. A white girl, I could probably do that, but not a black girl. Like we have to be mindful of these treatments. You will be completely pigmented. The packages and the single pricing, like we make the single pricing the highest purposely because I'm like, I don't want anybody to do this. This is dumb. But you can if you want, but it's not gonna like do, like you're gonna see a change, but like it's really the continued maintenance of this. By 3 months in, you're gonna be like, oh, I see this. By 6 months in, the people are like, look at my skin. Like they are glowing. I can see it. As soon as I walk in the door, I'm like, dang, what the F? Like I see the way light hits off their face. They look bright. I'm like, the pigment is gone. The light, like they just look healthier. And the patient's like, I know. They're like, I know. They say it. They're like, I know. Because they can see their skin change. So I'm like, it takes like 6 months to like really be feeling it. You'll see it 3-4 months. You'll be like, oh, I'm cute. But like 6 months, you're going to be like, I can see it. And people will see it. They will totally see it. So you can do the package, but I think we priced the package of 4 to be like, if you just do the membership, you basically, like you're only paying for 1 more. You get like 2 treatments or something. Yes, I'm 38, Sandra. Okay, I know. Somebody told me the other day, they were like, why are you talking about this Botox? You're in your 20s. You're too young. I was like, thank you. I'm 38. I appreciate you though. Okay, I have hollowness. Outer, lower lids. I want a permanent solution like fat transfer. Suggestions. I would get a consult for fat transfer and just see. I don't know if it's permanent because I've had patients that have done fat transfer and they're still like, oh, it didn't stick. Like they still have to kind of do stuff. I don't know if anything is permanent with this because our face is going to keep aging. But for hollowness laterally, you can do filler. You can do the natural filler. You can look at fat transfer. So do all your consults and then you can kind of decide which one you want to do. I just don't want to be like, oh yeah, this is the permanent option because I just don't know if anything is. Okay. What kind of sunscreen do I recommend for daily use on the face? I really love our JASI one. I have on a tinted one and we have a non-tinted one. I really wanted ones that'll work for black and brown skin. I love our JASI. And other than that, I just tell people, I'm like, find one that you like. You know, sunscreen is going to be based off texture. People, oh, I don't like the texture. People really love ours, but you got to find one you love the texture, the smell, the feel of it, all of that. Biggest thing is like find one you like and continue to reuse. That's the biggest thing. Yeah, ours works well. We do it. We use it after skin treatments. Like we do it on all colors of the rainbow, all skin types, and people really like it. Yeah, and they don't have to wear makeup with it. I think it looks great. In your opinion, what works best for dark under eyes? Natural filler or the traditional filler? For sunkenness, if it's just pigment, there's no hollow, there's not 1 ounce of hollow, I don't know anything to change, just the color of the skin. Okay, I'm gonna, hi, beautiful, so sweet, hi, Spa Boss. What do you recommend for textured cheeks? Only thing I need for clear skin, textured cheeks. I would do the skin pin microneedling and the bio repeal combined. Yeah, those two combined for texture works really well. The skin pin is going to like make controlled wounds on the skin. It's going to help turn skin cells over faster. So is your chemical peel. But the chemical peel can penetrate a little bit deeper when we microneedle it onto the skin. Okay, I'm going to keep going back. PDO threads. No, don't do it. Don't do it. I don't know. I don't do it in our office. I've been in this again since 2013, and threads, man, I feel like it's so hit or miss, even amongst us injectors and providers that have been in this a long time. People are like, oh my gosh, I love it. And other ones like, I don't see any change. I'm like, we can't even get on the same page about this. And for the ones that love it, I'm like, show me consistent results. I need to see a lot of results. I don't want to see one result. I need to see like 100. Like, I'm going to show you, if you ask me for some pictures, I'm going to show you 100 of some patients. I'm going to show you 1,000. Like, I'm like, you guys got me like 1, 2, 3 photos. And then like, and you're telling me, plus you did it with filler and Botox and threads. So I'm like, did the threads do it? Or did the filler and the Botox do it? Like, I get it. A lot of these things are combo treatments, but you know, for some of the things that I hear where people are like, I ask my patients, okay, you did their thread somewhere. Tell me about it. And they're like, I didn't see much. Oh, it did a lift, but it only lasted for 2 months. I'm like, you know, I don't know. So if you're going to do it, if you're really like set on threads, go to somebody that is doing it all the time. They can show you all the photos on a face that looks like yours. So I'm like, if you keep looking at these people that have before and after photos and they got a slim snatched face, but your face is, I don't know. I'm not saying this is about you, Monique. I'm just saying in general, your face is round and full. Like, that's not going to translate to be the same. So I'm like, show me somebody that looks like me. Show me somebody that has the color of my skin, that has the fullness of me. Like, I want to see all of that before I commit. And I'm like, I haven't seen anybody do that in aesthetics time after time after. Because if I did, I'd be like, I'm going to go learn from that person. I can't. I haven't seen it. And I've been in this a long time. Okay, let me keep scrolling back up. How many sessions for PRF for under eyes? Michelle, do at least 2, the natural filler. If you're like mid 30 plus, maybe 3rd, or if you're really sunken. If you're really sunken, do 3, but at least 2, spread them about a month apart. I want to know more about injecting your blood in your face. Mochi, I live in Florida. Okay, so the natural filler, guys, I'm going like scrolling up and down based on the question. So I'm trying to hit them. If I miss it, just like re-put it in there, but I talk too much and then I get more questions and whatnot. Okay. So the natural filler, we draw your blood. We do it in 2 tubes. We put it in the centrifuge, just spin it, zzz, and then it separates. I'm sure you've probably seen PRF, PRP, or like the gold part and the red part. So that gold part are your stem cells, your growth factors. We take that part out. A lot of people will just regularly inject that. We take it and then we heat it and we cool it so it thickens. So then we inject that. When it thickens, it's going to give us a little bit more of a lift than if we just did it as just a liquid. Also, when we heat it and cool it, it holds those growth factors in the skin longer. So you have longer exposure in the skin to those growth factors than if we just straight injected it without heating and cooling it and making it into a gel. You'll see a little bit of lift immediately, but the main thing with this is it gets better over time. It's making your body make new collagen. Now I tell patients, the younger and healthier you are, the better the outcome. So don't have a crap diet. Don't be smoking, drinking, doing all that sort of things, because then your body can't really make new collagen. So I'm like, you want to put yourself, like, I'm drawing it from you. So the healthier you are, the better. And then afterwards, continue to have healthy lifestyle so your body can put new collagen in that area. It works well. I have done it, my under eyes, my temple. I have done my face, my temples, my under eyes, my smile, and my chin, all the spots that I've usually done filler, but I can't do filler because of that baby. And I'm surprised he's not banging down my door. My husband is holding him down right now, which is great. Not holding him down. He's just holding down the fort of the other 3 kids. I'm breastfeeding, and so the natural filler is all I can do. It works well. And when I first did it, I didn't think I saw anything. As time went on, I was like, I don't look so haggard as this one. Woo. It was when I was 28 and breastfed that baby, my oldest, who's turning 11 in a week. I looked so sunken. Like, I looked so haggard and tired, like losing all the volume and all the spots. So this is like 10 years later, and I don't look all beat up. Sorry. I don't, my phone is grainy. Sorry. It came after my call. So sorry, guys. Like, maybe it's tripping me out more than anyone. Okay, I'm trying to see if I missed. Okay, now I'm going to go back down. Typically, how many units are for masseter Botox, Gabriella? 20 to 30 units per side into the masseters, depending on how strong the muscles are, how severe the symptoms are. So when we do this, I'm going through a thorough history. I got to feel you. I want to feel it flex. And then I'm going to be like, is one side hurt worse than the other? How many days a week are you feeling the symptoms? What are the symptoms? Give me a scale on 1 to 10. How bad is it? Do you have pain up here? So this temporalis muscle also is a chewing muscle. So sometimes people have pain here, and we're treating both. Sometimes it's one or the other. I go through a lot of questions with everything I do. Obviously, I keep talking way too much. I need to calm myself and zone. Okay, explain natural filler. I know it's from your own blood, but is it combined with traditional filler? No, Juanita, we don't combine it with traditional filler in the same day. Now, I will have people that come and they're like, hey, I want to start with natural filler, or I want to start with regular traditional filler. And then I want to come and maintain with the opposite. We can totally do that. I don't mix them the same day, because when I'm doing traditional filler, I really need to know precise, exactly how much lift I'm getting. Because if I overdo the traditional filler, it looks horrible. So I need to do that without anything compounding the outcome besides, the regular bruising and swelling that's going to happen. Now, again, I will retreat those same areas with one or the other. If a person says, hey, some people say, I want to start the natural way because I want that collagen stimulation. And then if they want more of a lift and I don't want to wait, we can go in and put filler, but I need to give it some time. I need to give it at least a month before I do it. Other people are like, I want the instant right now. Give me the instant with the filler, but I want to maintain with collagen because I know long-term we're going to keep aging. And I like the thought of the natural. I want to support the area so I don't have to keep running and chasing behind with filler. So we can do that, but just don't mix them same day. Okay. Am I a good candidate for Easy Gel for Felicia? You said, am I a good candidate for Easy Gel? You're so pretty. I'm trying to hit your picture. Again, healthier you are, the better the outcome. Healthy diet, take your vitamins, don't smoke, drink, doing all those things, or your body can make new collagen. 20s to 50s, they really 20s to 30s, they love it. 40s, 50s, they will do more than 2 sessions. So most people, I say, do a minimum of 2. Once they start getting 40s plus, they're going to do a 3rd session in retreating the same area. Mid 60s is where I'm a little iffy on the results, where I'm I think, if we need some heavy lifting because you've had a lot of volume loss, me just doing the natural filler, it's going to take a lot. Okay. I had Easy Gel 7 days ago. 4 days was best. Completely back to regular lips now. Easy Gel again. It depends on your goals. So remember, your natural filler is going to improve over time. If you are I liked it swollen and I want definition and I want for sure volume and I want to know what the exact outcome is going to be, do regular filler, because the natural one, you have to wait for it to get better, and it might not be as crispy or defined as we can get it with your traditional filler. So it just depends on the person. Same like nose, if somebody's like, camouflage my bump, I'm like, I need to choose like a strict, like not a strict, like a sturdy filler. Like I need to like something with structure. Whereas, I don't think that the natural one is going to give me a ton of structure. So it depends on the area we're treating. It depends on what you want the outcome to be. I will treat people's lips with Easy Gel if they're like, look, I'm just trying to get minimal little volume. I want more help with the improvement of the texture. No, I'm not trying to augment the shape. Like they just want like very subtle, nothing crazy, like really subtle. So it's just us talking through it. And some people really like it and like that's all I needed. Other people are like, most people are doing like filler. If they're like, hey, I want like some volume. Oh, I want the Cupid's bow. That's when we're going with regular filler. Any recommendations, injectors in Chicago? There is, gosh, I cannot think of her name right now. There's a derm. She's black. She's cool. I just cannot think of her name right now. I will try to think of it. She's on here. And God forgive me for not remembering her. Do I do live video consults? Yes, Mochi, I do. And that's why my screen is blurry, because I was talking to somebody when we hung up, it got all blurry. But we can do consults through here. If you want to jump in the chat, we can totally do that. Or we can do virtual consults one-on-one, in-person consults one-on-one, or with the team. Okay, I'm trying to scroll back and see if I missed any questions. If I missed it, I'm not trying to skip anybody. Just hit it back to me. Okay, I'm going back down now. Okay. And then I'm probably going to get oh, yes, Dr. Robinson, somebody said, Keith, thank you. Thank you. Okay, I'm taking arnica pills to reduce swelling from Easy Gel in 2 days. Good idea. Yes, totally. Arnica, pineapple, those help. Minimizing, don't take blood thinners unless medically necessary. Aspirin, ibuprofen, fish oils, ginger, turmeric, garlic. Those are ones that like make you swell and bleed more. So yes, keep doing your arnica now and then do it for a few days after. When it comes to Easy Gel and the swelling, 3 to 5 days, it's going to look a little exaggerated. Some people like it when it looks more exaggerated and filled out. Like if you're really sunken, they like when I do their eyes because it's like filled up. I'm like 3 to 5 days, it's going to look crazy, or you might like it. And then it's going to kind of look like you didn't do much. So that's pretty consistent. Somebody in here said they did it for their lips 4 days ago, and now they don't see much change. Remember, guys, it's going to get better over time, up to 6 months better. So we're getting new collagen. This is not the instant feel. Okay, does natural filler migraine? No, just think of it as like a fertilizer wherever you put it, which is really great. I got Easy Gel for the first time a few weeks ago, but I don't really see a difference. Angelina, same thing. I get Easy Gel in 2 days. Somebody else was saying, can't wait. I think you're really going to love it. It's going to get better. And remember, when I do Easy Gel, we only do it in a 2 session because I'm like, guys, if 1 session is not it, you want to retreat that same area. It will improve. It takes up to 6 months later. If you want instant results, go with your filler. Remember, this one is going to improve. It's going to get better over time. It's not quick. So we do a lot of like coaching so people can understand this is not instant. And the healthier you can be, the better your outcome. If you want more, you can always like add more to that area with Easy Gel, or you can talk about regular filler. But it's not, if you did it 2 weeks ago, I'm like, it's not it. Like I've had some people that are coming back, I did it 2 years ago with you, Ginille. I did it 1 year of my maintenance, and they're like, Ginille, it was really like 6 months in. They're like, look at this photo. I love this photo of me. And they're like, when I started feeling like, oh, what's going on? They're like, it was 6 months after we did the thing. So I'm like, just give it time. Also make healthy lifestyle choices so your body can make new collagen, but really understand it is not quick. It's not the overnight thing. I'm saying the same thing y'all said when I first did it. I was like, that was stupid. I don't see any change with it because I'm used to seeing hollowness on my own self and putting filler. I have this baby that I'm probably going to go in a few minutes. He's probably like, feed me, even though he's big. I have been doing the natural filler and I'm like, I don't look so haggard. This is my 3rd kid. I am 10 years. 11 is the oldest one. He's going to be 11 in a few days. I know what it's like when I lose volume from the fat being sucked out of my face. I'm like, I don't look so haggard this time around because I've done the natural one. So it will get better over time. Just make sure you know that. Okay. Injectors in NYC. I don't know off the top of my head. NYC. Dr. Davigan. I see her on TikTok too. Skin Vive. I don't know. Some patients I've done it really like it. Kind of hard to capture a good photo. Skin Vive is a skin hydrator. I'm not like, oh my gosh, I'm totally in love with it. Also, I haven't had it, so it's hard for me to like personally give my own recommendations. But the patients that we've done it on, they're like, they like it. But it's not like, oh my gosh, this thing that I'm like totally, I just haven't done it because it came out and I've been breastfeeding and pregnant. Y'all, can I? And like, I want to like stand behind something if I tell you. Easy gel results, usually 6 months. People can see it before then, but I'm like, it can take your body up to 6 months to get new collagen. So people will see improvements, but like 6 months, it can take up to that much time. Someone wants instant result. What's your default filler for under the eyes? Depends on the person and like how deep or sunken they are. More sunken under eye, deep hollow, deep bone, thick skin. I'm going like Voluma, Rest and Lift. If there's skin on bones, it's just a little bit, then I might be going like Bellatero or regular Restylane. So I got to feel on the bone. I got to like kind of see it, so those are the things. Can I roast you? No, I would never roast anybody. Sim, you want me to look at your picture? I'm trying to look and see. If you want to come on here, I'll look and I'll talk with you. I would never do anything out of any ill meanness, guys. That's just like not my thing. So, but I can talk to you about your face and, what can make things look balanced or how the face is aging. But I tell people, I'm like, dudes, if I'm ever telling you something, I am thinking about how the face is aging. I'm looking like, and this is just one opinion. And my opinion is not the beholder of beauty opinion. Like, I'll tell you what I see. I try to show you different patient before and afters. I'm like, if you like the way these patients look, this is what you can expect in the results. But I'm never here to like pick people's faces apart because I'm like, y'all, I know we don't need it straight up. Like, you are beautiful the way God made you. And I hope you see yourself how he sees you and love yourself how he sees you. And I tell this patient all the time, like, dude, you don't need it, but I can talk to you about what's going on your face. And I say, if I say something that doesn't bother you, ignore it. Don't listen to what I'm saying. Like, I'm not trying to make people feel self-conscious about something. I'm really talking about how the face ages. And like, a lot of people just don't know, but this is what I study and this is what I do. But yeah, that's just something to keep in mind. But if you want, I can talk. I will not roast you. That's not nice. For in-person consultation, does the payment go towards treatment? Yes. So if we do a virtual consult, virtual consults are $150. In-person consults are $350. Payment goes towards your treatment if you do it within 3 months for the virtual consult. If you come in person, it's for the same day. Yeah. Do I do the Fern technique for smile lines? Yeah, I mean, whatever. I'm not like totally chasing smile lines. I tell people I'm not trying to get the smile line all the way gone. If we get it all the way gone, it'll look a little bit weird. But yeah, I do try to soften them, but I'm not just here. Sometimes I'm looking at these other spots, the corners of the mouth. I'm thinking about the whole thing, but I don't like just chase the line to be gone. At Angelina. Okay, where are you located, Lala? In Vegas, on the Summerlin side, next to the lakes. I'm not like super familiar with Vegas, but that's what everybody tells me. I know I'm right next to the lakes. It's 8861 West Sahara. I'll be there on the 14th, but we have team members there, seeing patients every day. I go like once or twice a month. But yeah, how many sessions for Easy Gel for mid-30s before switching to traditional filler? I would say probably 3 in the same area. So you don't want to do like your 3 sessions. You don't want to do like, oh, I did my eyes 1 session. I did my smile lines 1 session. I did my temples 1 session. Like 3 hit the same spot. If you're really hollow, if it's your under eyes, or really deep, like hit that spot, probably more. If it's just like, oh, a little bit, like if you're spreading it too thin, you're not going to see it. But probably 3, mid-30s, depending on how deep it is. Give it a month in between the sessions. And then let me see if there's other ones. Yes, Lala, yes. I'll be there soon. Okay, I'm going to go get these babies. If you think of other questions, I would try to come on here, and I try not to have a grainy screen. I don't know what I did, guys. But DM me. I try to make sure I hit them all, but sometimes I'm like, oh, sheesh, I didn't see that. Text the team, the number on the top of the page. Like, my team is on it. I see all of them that go through, but like, they don't miss a beat. Like, these girls are on it. These are girls I fully trust, and they've been working with me side by side for years. Or you can, when I come on live, we can do this here, or at the top of the page, you can make the virtual consult in about a week or the end of this week. I will have a new website up. So it will be easier to like book all your stuff. Right now, the website's been just under my name, Ginille Beauty, but it's not just me. It's like we've been having whole teams of people here, and I'm like, this is not the Ginille show. So it's going to be switching to JASI Skin. It's super easy to do the online booking for all the locations, which is just going to be nice. Angelina, I hope you have a great night. And yeah, if you guys ever think of anything, please let me know. God bless you. I appreciate you. Send a message there. I will see you soon. Again, we're in Las Vegas. We're in Los Angeles. I'm Ginille. I've been doing this since 2013. I went to Stanford, went to Duke. Yeah, I'm going to like put my heart and soul in it. Any questions you have, let me know. Don't rush your treatments. I will talk to you guys soon. I hope you have a great night. God bless you.